I first heard about neurofeedback when a client of mine went out and found it for himself and came in about 5 years ago. He had had 3 sessions of neurofeedback by that time, and he was visibly different. I was shocked. He was so much less anxious that it confused me. I'd never seen that before.
I was first exposed to neurofeedback by accident. I got divorced 15 years ago and had been invited to join a practice. Walked in one day and I saw this little kid sitting in a chair watching these little people eating each other, you know, something like Pac-Man. And I went up to the therapist and I said, this is a psychology clinic, what are you doing? And he talked to me a little bit and I said to him, you know, can you help people that can't sleep? Because after I'd gotten divorced, I just couldn't sleep. I was taking care of 3 kids and I was exhausted. And he said, sleep, piece of cake. And I said, sure. And he said, just wait a while and I'll sit you down in the chair. So basically, within 15 minutes, I was asleep. And I said to him, I'm going to learn this. I've got to learn how to do this.
I work a lot with clients who have addiction problems. And so the idea of calming the brain, which neurofeedback does well, integrates very well. Also, about 30 to 40% of my adult clients have ADD. And neurofeedback's quite good with that. So it blended in very well with my current practice in psychotherapy.
When people call for information, particularly young women, the question is often, well, have you done talk therapy before? And if so, do you know what the issues are, but you're still stuck with the feelings? If so, then maybe it's time for the neurofeedback. But if you need to do the talking to get the issues straight, to do the narrative, to get a sense of yourself, then that's not what biofeedback does for you. What it does for you is it settles symptoms. Sometimes it's better to do it first because then you'll be able to benefit more from the therapy because you won't be dealing with the symptoms. Sometimes it's better to do it on the far end. Ideally, you do it together, but payment systems aren't always possible with that.
And it just enables people to go work with, you know, more superficial symptoms like panic attacks or anxiety or depression, and then go into much deeper things that are caused by trauma. There are a couple of different levels to the treatment.
I've got kids that I work with that helps get them through school with either less or no medication. I've got adults who it calms down their level of anxiety, helps them to function way better in their relationships.
Of course, it doesn't always work for everybody. Nothing does. But if you get it right, it repeatedly feels as if you've waved a magic wand and the problems, multiple problems have disappeared. Problems that we used to think were endemic to personalities can simply go away practically overnight. And it's astonishing.
One of the reasons I got into neurofeedback was to provide some variety in my schedule. I was going hour after hour after hour of sitting with people talking about difficult subjects, and neurofeedback actually gave me a breather. Quite different mode, different way of working, and it has made my practice much more doable. One of the most touching moments I've had in here was when a mother came in who had come to pick up her high school son, and she told me that his social anxiety had reduced enough because of neurofeedback that he had decided to go to the high school prom, and she couldn't believe he was doing that, and she was thrilled. He bought his ticket on the last day he could, but he did go.